I'm a level 2 student nurse at McMaster University. Today we're going to be performing 2 injections, 1 injection for heparin and 1 injection for Haldol. So I'm going to perform hand hygiene. And so now from the MAR, I'm going to check what medication Mr. Mancini needs, what dose. So here says Mr. Mancini. He is diagnosed with pneumonia. He is allergic to codeine. Mr. Mancini, do you have any other allergies?
No.
Okay. The medication order is heparin 5,000 units subcutaneously, along with 1 milligram of Haldol, IM. Okay, so there's only an allergen to codeine, no other allergies. Now I'm going to go through the 8 rights. So, right medication. From the MAR, we can check 3 times just to ensure it's the right medication. Right reason, so we don't have enough information to actually tell what the right reason for the medications are, except we do know that heparin is a blood thinner. Mr. Mancini is diagnosed with pneumonia, so it might just be because he's been in the hospital for a long time sitting, and blood thinners are usually used for patients. And Haldol is an antipsychotic, so yes. Now right dose, we're also going to reference the MAR, so we need 5,000 units of heparin and 1 milligrams of Haldol. We want to look at the route of administration, so it says one is subcutaneously and the second one is IM. The next right is right frequency or time. Looking at the MAR, it says every 12 hours for heparin and every 4 hours as needed for Haldol. Next, we're going to look at the right patient, so we can assess patient identifications. So it's a wristband, so you can look at name, date of birth, identification number, and you can compare it with the MAR to see if that's correct. Next, for right documentation, after you've administered the medication, you would then go and document that they have taken their medications. They also have the right to refuse, so if they don't take their medication, that's okay, it's their body, so they have the right to refuse. Next, we're going to assess body build, muscle mass, and their weight. So Mr. Mancini looks very lightweight. Looking at their muscle mass, appears to not have an abundance of it. And their body build is very thin. So for these reasons, we're going to administer a 25 gauge for subcutaneously and a 22 gauge for an IM. Using the injection pad, we're going to assume that Mr. Mancini has thick skin and a decreased muscle size. Okay, so now we're going to perform hand hygiene before we assemble our subcutaneous and IM needles. For our subcutaneous needle, we're going to use a 25 gauge needle, and this is my heparin, and I have Haldol here. So now I'm just going to use a blunt needle to administer the medication. I'm using a 3 milliliter syringe for the heparin, because we are administering 1 milliliter to Mr. Mancini. Now I'm going to open the cap away from me, take off the cap of the blunt needle. I'm going to draw out 1 milliliter of air and insert it into the vial. I'm going to pressurize the capsule. Turn this upside down and draw out 1 milliliter of heparin. Okay. Take this out. I'm going to get rid of any bubbles. And okay. Now I'm going to, for the purpose of this video, I'm going to recap the blunt needle. And twist it off and replace it with the 25 gauge subcutaneous needle. now we're going to administer the 0.5 milliliters of Halidol with a 22 gauge needle, taking off the lid the same way we did with the other. I'm using a 1 milliliter syringe just because we need 0.5 of a milliliter. And in the purposes of this assessment, I'm using the same blunt needle, but I would use a different needle for this case. Okay, so now I'm going to draw out 0.5 milliliters of air, insert this into the vial, and pressurize the capsule. Next, I'm going to turn it upside down, making sure that there is no it out all the way to 0.5. And getting rid of any bubbles. Okay. Now I'm going to recap the blunt needle. Untwist it. And replace it with a 22 gauge IM needle. I have prepared the syringes with our medication. I would label the medication, what medication it is, and the dose on both of these syringes. Alright, so now what we're going to do is we're going to landmark for the location of our subcutaneous injection site. We can do this either in the abdomen, thigh, or lower back. For the purposes of this assessment, we're going to do it in the abdomen, 2 inches away from the umbilicus. Before we start, we're just going to do a patient identifier. So we're going to ask for name, date of birth, and patient number, and we're going to compare it to the MAR to see if this is correct information. So all information is correct. We have the right patient and the right medication. Next, we're going to palpate the area, just checking for any lumps, bumps, bruises, abrasions, and any tenderness that the patient might feel. And now we're going to switch to our subcutaneous injection pad. What we want to do is we want to first put on gloves and perform hand hygiene. And clean the area with an alcohol swab, making sure to start from the site of the injection and circle outwards 5 centimeters in diameter. Okay. Now what we're going to do is we're going to remove the safety on this and uncap the needle. We are going to make sure that you put a piece of gauze in your non-dominant hand, and you're going to pinch the injection site and administer the medication. Since this is heparin, we're going to continue to pinch the injection site while we are actually injecting the heparin. Okay, now remove the needle and replace it with gauze. And in a normal case, you would recap this needle by putting on the safety. However, we're going to just recap this needle. We're now going to administer the IM injection. Injection sites include the deltoid, the vastus lateralis, and the ventrogluteal. For the purpose of this assessment, we're going to do the deltoid. So for landmarking, what we're going to do is we're going to roll up Mr. Mancini's sleeve, find the acromion process, and go 2 fingers down. And this is where our injection site is going to be. So what we're going to do is we're going to palpate for any bumps, lumps, abrasions, and any tenderness. And I'm not feeling that, so we are good to administer the medication. So moving on to our injectable pad, what I'm going to do is make sure to clean the area using an alcohol swab. Again, using the same technique as the subcutaneous, starting from the middle, circling in an outward motion 5 centimeters. Making sure to prepare gauze in the non-dominant hand, uncap the safety needle, like so. And we're not going to pinch for a IM injection. However, we're going to insert it in a dart-like motion and insert it 1 milliliter every 10 centimeters. So we're just going to make sure to hold it for 5 seconds. This is 0.5 milliliters. And first, so we are injecting it. What we want to do is make sure we aspirate to see if there's any blood If you feel resistance, that means you are hitting muscle and not a vein or anything like that. If I did see blood, I would take out the needle and restart the whole process. So now I'm going to administer the medication and hold it there for 5 seconds. And remove it, replace it with gauze. So for the purpose of this assessment, I'm not going to recap it using the safety. I'm going to like so. And then with these needles, I would dispose of them in the sharps container. Okay, so now we are done the assessment. I will remove my gloves and replace them in the garbage. All right, Mr. Mancini, so today we did 2 injections. We did your heparin and Halidol medications. Let me know if you feel any discomfort, any tenderness or redness in the area, and I will check back on